I'm going to talk about how physiotherapists may use typical development of movement in their treatment of children with cerebral palsy. If we think about a baby when they're first born, they're totally dependent, and then after a couple of years they are then able to move around, explore their environment, do lots of different skills. So they've changed hugely. The two key factors in this is they've been able to move and explore primarily because they've been enabled to deal with gravity. And secondly, they've been able to do this because they have practiced all the time. Babies are never still. So these are things that we need to consider when we're using typical development of movement as a framework for our treatment with children with cerebral palsy. We can look at the motor milestones, i.e. the skills that are learned, and we can say that they tend to be learned in a sequence. So head control comes before rolling, and sitting comes before, say, standing. So there is a sequence, although it's not absolutely in stone. So for example, children may not crawl. Lots of children don't crawl. The other thing is that there's a rate at which we expect these skills to develop. It's not an absolute one-off date, but it's a range, which again suggests that there's variability in how children learn these skills. If the rate is slowed down, then we know that perhaps there is some potential for delay, motor delay. And if the sequence is unexpected, so perhaps not the predicted flow, then it may be that there's some motor deviation. So looking at the sequence and the rate gives us some clues about children's development. The other thing that we look at closely is performance, the motor performance, and again we can use the typical development. We don't tend to look at development of individual muscles, that would be really difficult, but what we tend to do is look at development of what we call movement patterns. Gravity is very important in learning motor skills, and what we tend to do is look at movement patterns in relation to gravity. We can do this by looking in different positions. Typical positions that we might look in is when a child is on the floor on their back, which is what we call supine, when they're on the floor on their tummy, which is what we call prone, and sitting and standing. We can analyse quite carefully what motor patterns are being used, and if we think they are completed or if there's anything missing and perhaps we need to target some activity. For example, when a child is lying on their tummy, which is often a position that therapists like to work in, we know that when the child moves away from the supporting surface, away from the floor, they are using what we call a motor pattern called extension. And extension is really important and something that we're often working for. If the child is starts off on their backs and they move away from the supporting surface, they also will be using a motor pattern, but this one is called flexion. So flexion and extension is something that we use to analyse activity. The other thing that we look carefully at is weight-bearing areas. The weight-bearing area is the part of the body that's left on the floor. So for example, in walking, it's a very small surface area, it's the feet, so the child has to really be able to balance well. The supporting surface will give us an idea of how the child's got up off the floor. It will show us where the activity is, and it will give us some clues about balance. And I'd like to go on and show you an example of what I mean. Thank you. This diagram is representing what we would expect a typically developing child to look like on their tummy. The child is pushing up into an extended motor pattern off the supporting surface using the arms. The upper trunk is raised off the surface, but the lower arms, lower trunk and legs remain in a weight-bearing position to provide stability. This child can play comfortably in this position. This young lady, however, has a left-sided hemiplegia, and notice the difference in her activity compared to a typically developing child. She is ignoring that left arm. She's not using it to push up with, and she's not using it for weight bearing. It's important that we target this activity so that we get the best use out of that arm. So I can adapt the position. I can place her arm in a position where she has to use it more actively for weight bearing. Notice as I move that arm underneath her body further, she lifts up into a more extended position. I would explain this to Mom and ask if she could possibly practice doing this at home little and often. I would also gently push her over onto the left side so that we get the best activity, best weight bearing through that left arm. And notice now as well, she can look at the toy. She can also play more effectively with that toy because she's got a more free arm and she can now lift it up. Her left hand, however, is fisted. I would want to try and improve that by actively, gently opening those fingers and improving the weight bearing position for that hand, and also help to keep those fingers more relaxed. Thank you. I hope you've enjoyed the video, and please contact if you have any further questions.